welcome. I'm Ana Diez-Roux. I'm director of the Urban Health Collaborative, jointly with Usama Bilal, whom you'll hear from later. And on behalf of the Drexel Urban Health Collaborative and the Dornsife School of Public Health, it's really a pleasure to welcome you to this 2025 Urban Health Symposium, which is our fourth symposium in a series that began in 2015. In fact, we have some folks with us today who were with us in 2015, which is wonderful, really, including some speakers. So it's terrific that we have many of you back to help us reflect on today and what the next 10 years should bring. I think I also want to mention that we have folks joining us from all over the country and also from Philadelphia, of course, but also globally from a number of countries all over the world. And that is also really important to us because there's so many things, so many challenges and so many opportunities that cities share. And we really believe in learning and working together and partnering. And this particular symposium, I think the 2025 symposium is I think especially meaningful to us for two reasons. The first is that it's our 10th birthday. It's the 10th anniversary of the Urban Health Collaborative, which was really founded with the first symposium back in 2015 with the goal of really bringing together rigorous research, training, and partnerships to transform urban health, to improve health and eliminate health equities in cities all over the world. Of course, we had a lot of support from the School of Public Health, from Drexel University, from Dane and David Dornsife, who gave a wonderful gift to help us launch this work, and many external funders who have supported us along the way. And we're very happy that we've been able to build what we feel is a thriving, supportive, and productive community that really strives to generate rigorous science, but also see that science transformed into real actions and meaningful social change in the US and globally. And there's a second reason why I think this symposium is particularly meaningful to us. Perhaps more important reason is, and it has to do with the many threats that we are seeing to public health, to science in general, and more generally to the social and environmental interventions and policies that are critical to protecting health for all today in today's world. Many of these threats and challenges are magnified in cities, of course, for many reasons, but also I think we have to remember today that cities, because of their diversity, because of their energy, because of their history, can also be places for debate, for critique, for progressive thinking in the best sense of the word, that challenge the status quo in ways that can advance health and health equity in the future, even as we're traversing difficult and challenging times. Advance health as well as equity, social justice, and environmental sustainability that we really see as closely interrelated. And in times like these, we feel that spaces for discussion, debate, and reflection of ideas old and new on what we need to do as a society to create health for all are especially important. And we hope that this symposium will be such a place for you all. As in the past, we'll begin grounded in reflections of US city health commissioners. I was just speaking to Mary Bassett, who we remembered that she was on the stage as the first panel of health commissioners in 2015 as New York City Health Commissioner. And it was a fantastic panel, and I'm sure today's will be as well. So we really want to start with that grounding. Then we'll move on to a panel on climate change and its impact on urban health worldwide. We'll have a traditional session we always have on innovative data and methods in urban health research. And also a session on community and policy partnerships and evaluation of policies and interventions to advance health equity in places and neighborhoods. We're also very fortunate to have two distinguished speakers, one today and one tomorrow, on fantastic titles. I'll let you look at the titles and wait for the introductions, but I'm sure they will be energizing and motivating. keynotes. And then we'll close with a panel on reflections and directions for the next 10 years. And we hope that you, will participate in that final session with your ideas and input. We have a poster session this evening and a reception and celebration of our 10th birthday, so please join us for that. We have wonderful posters as well. And I just want to give a special thanks to the organizing committee. You can see them all in your program, but a very special thanks to Claire Jensen and Derek Harris and Autumn Carochi, who have really done a huge, incredible amount of work putting all this together. Thank you again for joining us, and we look forward to your input and discussion and ideas throughout. And so, without further ado, I want to turn it over to Jen Coker, who will moderate our first panel. Jen is professor in the Department of Health Management and Policy at Drexel University here at the School of Public Health. She's been on faculty since 2004, and I had the pleasure of working with her when she was Associate Dean for Public Health Practice and External Relations for 10 years. And she is a co-lead of the policy core of the Urban Health Collaborative and has a lot of experience spanning nonprofits, academia, government. So she's one of those people who can really bring all these things together. So I'll welcome Jen, and she will introduce the panel. Thank you.